So what should you do if you just had a facelift and you wake up and your smile is crooked? Hi, I'm Dr. Babak Azizadeh. I'm a double board certified facial plastic surgeon and a facial nerve expert at the Facial Paralysis Institute. And because I do a very high volume of facial nerve reanimation and facial plastic surgery with facelifts and deep plane facelifts, this is one of those unique areas that just kind of intersect. So the critical issue is that with facelifts, no matter whether it's a deep plane facelift or a SMAS facelift, the nerves can be temporarily or permanently damaged, depending on the technique, depending on the surgeon, depending on sometimes even if everything's done really well. So the most important thing, if you notice any smile discrepancy or issues or eyelid issues, you need to let your surgeon know immediately. That is a very, very important part of your plan. And your surgeon should have a good understanding of what he or she has done and what needs to happen next. In most circumstances, facial nerve issues after a facelift tend to be temporary in nature and resolve. Now, it may take several weeks or several months to resolve, but there are certain circumstances that do require us to explore and do what's called a facial nerve exploration to see if there is a nerve that's not just injured, but potentially separated that needs to be brought back together. And if that is the case, then we have to do that at some point. Now, sometimes you have to do that immediately. Sometimes you can wait and see how things go. All of this requires an extensive amount of facial nerve expertise, and most surgeons will refer you to a facial nerve expert like myself to further evaluate and give you guidance.